Hi, Mrs. Lemon. I'm Allison. I'm going to be your student nurse today. How are you feeling?
Not too good.
Can you tell me more about that?
I've been throwing up and I'm in quite a bit of pain.
Okay, and whereabouts is your pain?
Along where they cut me.
Okay, and on a scale of 1 to 10, how bad is it?
Like a 7 or an 8.
7 or 8, okay. And you said you've been throwing up all morning?
Mm-hmm.
Okay, I'll go and check your doctor's orders and see if there's anything we can give you to help you with this.
Sounds good.
All right. So I'm checking the doctor's orders, and I see that we can give her morphine and Gravol. And to understand what dose I'm going to give her, I'm going to check and see what previous nurses have given her, and I see that they've given her 5 milligrams of morphine, and that has controlled her pain quite well. And let me just see the Gravol. And they've been giving her 25 milligrams of Gravol, which is 1 milliliter, and that's been controlling her nausea quite well as well. So I'm going to prepare my medications. I'm going to start off with the Gravol first, since it's a multi-use vial, and then that way I won't be injecting any of the Gravol into it. So since I'm giving 25 milligrams, it's 50 milligrams per 2 milliliters, which would be 25 milligrams per 1 milliliter. So I'll give her 1 milliliter of the Gravol. And the top is sterile since I just took off this cap. I'll inject 1 milliliter of air into this. And I drip 1 milliliter. Just going to put the cap back on the blunt fill. And next I'm giving her 5 milligrams of morphine. It's 5 milligrams per 1 milliliter, so I'll give her this entire vial. And since this is a vial, I'm going to put this alcohol swab on it just so I don't cut myself. And then I would discard that top of the morphine into the sharps container. So I'm going to drop another milliliter. So there should be 2 milliliters of medication in here. There we go. And then since this is a opioid, it's a high alert medication, I would get my instructor or another nurse to double check this. And I'm going to write my patient's name and medication on this label. So it's Marjorie Lemon. Morphine and Gravol. And on the show that I made this medication, or I drew it up, I guess. I didn't make it. Okay. So now I have this already. And before I give this medication, I also want to check to make sure there's no contraindications for if she has any allergies to morphine or to Gravol, or any contradictions to getting an IM injection in general. And her charts say no, so I'm good to get this medication. I'm going to discard this blunt fill needle. If I can get it off. There we go. And put on the 1.5 inch, and it's a 25 gauge, so this is a good size IM injection for the ventrogluteal site. So I have my gloves, alcohol swab, medication, and the MAR. And before I leave the room, I also want to do another check to make sure that I have the right dose. So I'm checking 5 milligrams of morphine, 1 milliliter, Gravol, 25 milligrams per 1 milliliter, and perfect. And I have 2 milliliters in here. Whoops. All right. Hi, Mrs. Lemon. I have all your medications here. Could you just tell me your name and birthday?
It's 79.
Perfect. And now I'm just going to compare the wristband to the MAR to make sure that this is the right patient. I'm just looking at the hospital number. All right, and I'm also checking her wristband to see if there's any allergies that I didn't read in her chart, and there's none, so. Okay, Mrs. Lyon, I'm just gonna readjust you in bed. I'm gonna be giving you an injection in your ventral gluteal site, which is just right here, so. Can I have another nurse to help me?
For sure.
All right. How are you doing, Mrs. Lemon?
Okay.
All right. So now I can have a good view of the injection site. I'm just gonna inspect this area for any bruising, redness, tenderness. Is it sore at all around here, Mrs. Lemon?
No.
Okay, perfect. So now I'm gonna landmark. I'm feeling for the greater trochanter. My thumb is going towards the groin. I have my fingers to feel for the anterior superior iliac spine and the iliac crest. And so I see that my injection site will be right here. So Mrs. Lemon, can you just move your leg? And when she moves, I can feel the muscle moving, so I know that I'm in the right spot. So now I'm just going to cleanse with the alcohol swab. I'm just gonna find where I'm going. I'm gonna inject it right in here. And I'll leave the alcohol swab just as a marker so I know where I'm gonna go. All right. Put my gloves on for my own safety. I'm just going to use my left hand just to draw back to do the Z-track method. I'm going to inject, aspirate to make sure I'm not in the blood vessel. And now I'm going to inject the medication at 1 milliliter per 10 seconds. How are you doing, Mrs. Lemon?
Okay.
Oh, perfect. Alright, needles out, and I'm going to release the skin. There we go, and then if there's any bleeding, I could put on a Band-Aid for her. How does that feel, Mrs. Lemon?
It's fine.
Alright, so we'll just get you back into a comfortable position. There we go. Alright, Mrs. Lemon, I'll come back and check on you in about 10 in for 15 minutes and see how the medication is working. Alright?
Sounds good.
And now I'm just going to clean up my environment and chart.